Your AI health startup might be unintentionally creating illegal medical records. AI outputs can qualify as regulated health records, not merely temporary logs. AI prompts, outputs, and metadata may be regulated under Digital Personal Data Protection Act.
Integrating with national health infrastructure means your AI isn't isolated. Retrofitting compliance post-scale is exponentially challenging. Founders often mistakenly believe compliance starts after scaling, or that hospitals manage all regulations. However, every AI interaction creates a potentially regulated data trail. This includes prompts, outputs, metadata, identifiers, embeddings, and clinician actions. It's crucial to recognize these elements as part of compliance from the outset. Under DPDPA, inference logs containing patient identifiers, ABHA IDs, symptoms, diagnoses, transcripts, or clinician notes are sensitive personal data.
Logs linking outputs to individuals require explicit consent. Clinical context in prompts creates health records. Transcripts and clinician notes are sensitive upon entry. You're thoughtful. Even telemetry can be regulated when combined with identifiers or clinical context.
AI outputs can become medical records when integrated with Ayushman Bharat Digital Mission. Structured notes, treatment recommendations, discharge summaries, and risk scores enter patient records. These outputs accumulate into longitudinal health histories, subject to the same regulatory rules as traditional records. Your AI is now part of the national health infrastructure. Indian health tech startups face compliance gaps, infinite retention of logs, protected health information in analytics tools, and raw training data usage. Shared admin access lacks role-based controls, and inference logs have no expiry. These practices risk patient privacy and regulatory compliance, highlighting the need for robust data management policies. Hospitals now demand compliance as part of procurement. They require audit trails, retention policies, and proof of consent architecture. Digital Personal Data Protection Act readiness and role-based access controls are essential. Incident response plans and web application security assessment reports are standard. Mature procurement processes mean compliance gaps can block vendor selection. Ayushman Bharat Digital Mission integration transforms your AI system into a crucial part of India's national health data network. Handling Ayushman Bharat Health Account Integration, Health Information Provider/Health Information.
User flows and fast healthcare interoperability resources records requires strict adherence to health data regulations, consent artifacts, and audit requirements. Empathy. Your AI must ensure compliance as it processes nationally registered health identifiers, becoming legally accountable within this ecosystem.
The real risk in health AI isn't fines, but compliance debt. Retrofitting auditability, consent architecture, and secure machine learning pipelines post-scale is exponentially costly. Auditability gaps, consent architecture debt, and insecure machine learning pipelines compound over time, making compliance a daunting challenge if not addressed from the start. Smart startups prioritize compliance from the start. They map data flows, establish retention rules, and integrate consent logging with role-based access. Running data protection impact assessments for high-risk artificial intelligence features ensures safety and efficiency. Early compliance efforts reduce costs, streamline procurement, and prevent future compliance debt. Book a free compliance consultation with Brain Labs. Identify AI pipeline risks, prepare for Digital Personal Data Protection Act and Ayushman Bharat Digital Mission, and reduce procurement friction. Build scalable compliance systems. Visit brainlabs.org/consult.